Today on Substance Stories, we're doing a crash course on inhalants. How to get help, how to use them safely, and how they work. Today I'm going to talk about the other inhalants. So recently we talked about nitrous oxide. I'm going to talk to you about volatile solvents, which is paints, petrols, fridge coolants. I'm going to talk to you about inhaled anesthetics, which is sort of ether, chloroform, and isoflurane. And I'm going to talk to you about nitrites, which are sort of isobutyl nitrite, amyl nitrite, they're otherwise known as poppers. So volatile solvents, these are things that people tend to inhale and they get a sort of high off it. How they work is a bit like alcohol. They sort of work on GABA, which is the brain's main inhibitory neurotransmitter. So it slows us down and makes us feel wonky and get a bit out of our head. However, these substances are quite dangerous. Why are they quite dangerous? Well, really, there's a thing called sudden sniffing death syndrome, which no one really understands too well, but there are a certain amount of people that on first go of these substances can just die. And that's a terrifying concept because there's no real way of knowing whether you will be one of these people that will have sudden sniffing death syndrome, but you could be, and that will be the end. The other thing that they do that's quite risky is that they're very flammable, and because they're a solvent, because we're inhaling them, they sort of go into the area. So if you're using them in an enclosed space and you don't notice, they sort of take up more and more space in that area until you're breathing in more of this solvent than you are of anything else. So it's not unusual for people to be, trying to do it in a secret area. Maybe we go into a cupboard to try and get high alone, but we don't realize that we are asphyxiating ourselves on these solvents. It's really dangerous. They're also associated with quite a lot of sort of brain damage and learning disabilities, but it's unclear because of the sort of people that tend to get into sort of sniffing petrol, who generally come from a sort of lower socioeconomic and more sort of social disadvantage. It's unclear whether there are other factors that are playing a role in some of the cognitive impairments we see in people that use it, but who knows? I think certainly they're unlikely to be having a good effect on the brain and our cognition in the long run. So what do we do if we are using volatile solvents? Well, the first thing is I guess if we're already using volatile solvents, we don't need to worry about sudden sniffing death syndrome because that would have happened or wouldn't have happened. We do need to do some harm minimization stuff. So we should never be using alone, right? We should always be using in a well ventilated space, and we should never ever have them anywhere near fire because they go up. Obviously, petrol goes up, and that can be really, really dangerous. The second thing we need to do is we need to be reaching out for help. It is really dangerous to take these drugs, and if we're in a space that we need to take these drugs, that we're feeling addicted to these drugs, we need help. No one is alone. We need to be able to get help, and we need to be able to get help soon, especially given the seriousness of these drugs. Speak to a drug and alcohol counselor, speak to your local doctor, speak to a psychiatrist, speak to an addiction specialist. Get help. You are not alone. There are lots of people that can get better from being addicted to these medications. And when we do that, when we speak to those professionals, we try and work out what it is that's driving our addiction. Why is it that we need to get out of our head? What is the underlying cause there? Do we have a mental illness? Do we have too much disadvantage, not enough opportunity in our life? If we address that, we're not going to want to use, and we can get better. So that's volatile solvents. Inhaled anesthetics are very, very similar. These are medical anesthetics that people sniff and can get very, very sedated from. So it's important to keep in mind with inhaled anesthetics that they're very, very strong, and it's very, very easy to have what you think is a little amount and for that to actually be a lethal dose. So you got to be really, really careful with it. And it is quite a dangerous medication. It's quite a dangerous substance to take. The same thing applies to using in a ventilated space, using with people present to make sure that you're doing it safe. Again, if you are using inhaled anesthetics, this is quite a serious drug to be using, and it's very indicative that there are a lot of bad things going on in your life, and I really, really recommend reaching out for help as soon as possible, because these are very, very serious substances, and if we're at the point in our life where we're thinking about using these very serious substances because we just can't bear being sober, I think it's indicative of a lot going wrong in our life, and I think we really, really need to reach out for help. There is always help there. Inhaled anesthetics work in a very similar way to volatile solvents in terms of they're both GABAergic drugs. They both make us feel sedated in that manner. The last substance I want to talk about is nitrites. So they're also known as poppers, and they're sort of very popular in the LGBTQI scene. Now, what they do is they're smooth muscle relaxants. So these are very interesting medications from the purpose of they don't actually act on the brain. They act on our smooth muscles around veins, and they cause venous pooling, and that venous pooling makes us feel a bit wonky. So they're very popular in the LGBTQI scene because they loosen our smooth muscles, which includes our sphincters, which can be used instead of the chemsex scene. They absolutely do have risks though. So they're a bit like what we talked about last week with nitrous oxide, where there's this myth sort of in the community that they are sort of harmless and they can be used willy-nilly without any worry. But absolutely they can be dangerous. For starters, like volatile solvents, they're incredibly flammable. So you should never smoke around these. Also, uh, they can be chemically very volatile, and if you get a bit on your skin or in your mouth, it can absolutely cause serious burns. So it's not something that you want to just be sloshing around on the dance floor. If you're taking it on the dance floor and you do a particularly vigorous move and hit someone in the eye, they could easily go blind. This is a very, very strong chemical that shouldn't be used with anything other than absolute care. The other thing, and I think really important to tie it back to the chemsex scene, is that if you are using these with a medication like Viagra or Cialis that helps you get an erection or maintain an erection, it can be a deadly combination. So nitrites and medications like Viagra or Cialis can result in death. These are two medications that should not mix at all. And if they do mix, you need to go to hospital immediately. So it's really, really important that if you are someone that likes to go to a chemsex scene and you like to use nitrites like poppers, and you're thinking about using a Viagra, you really do not combine the two. It can be an absolutely deadly mix, and it can absolutely kill you quite quickly. Well, that was my crash course on inhalants. I hope it was interesting, and thank you very much for listening.